Good morning again to everyone, and thank you to the organizers for this opportunity to stand in front of you a second time after an inspiring 3 days that at least have given me a lot of more insights and knowledge. So the title of my presentation, Nurturing Care for Early Childhood Development. In the next 10 minutes, I hope to be able to paint the picture of a roadmap that we start seeing in front of us to build the systems that will enable us to reach every family and every child. I start with a bit of science and then move into the application. So, the amazing journey of human development, from a fertilized cell to a bright 8-year-old individual, early childhood development, the period it spans. A genetic blueprint giving the broad strokes of development, the environment that modifies that. Foundations are laid down in the first 1,000 days. And this graph shows how functions of sensory pathways, language, higher cognitive functions, the synapse formation for that takes place rapidly in the early years of a child's life, and hence the focus that we should not miss these years in targeting our support to families and interventions for those who need it. Common risks are ample. They relate to poverty, nutritional deficiency, stimulation. You see the list in front of you. So tackling those is important. They often come in clusters. Families who have one risk often have more than one. So as the environment matters, we can see that across the life course, when a child is being conceived, it's important that the parent is in good health and well-being. Care before conception is essential. The pregnancy environment has an impact on how the fetus develops, and then the environment, early childhood, infancy and early childhood are critical. And if these pathways are followed well, then optimal outcomes can be achieved for that individual in health, learning, and behavior that are important in early childhood but have lifelong benefits. So the life cycle is the binding framework in this agenda where we see how we need to provide inputs across the different stages of the life course, but also have seen through the science that when that is done well, the benefits are ample for the current generation of children, but also for the generation that follows, where they are the parents, and we have even evidence to say the generation that follows after that. Unfortunately, the burden of children at risk of suboptimal development is high. 250 million, we have heard the figure, due to factors of poverty and stunting alone. And the cost of inaction that comes with that is tremendous. At the individual level, studies start pointing that individuals who were supported in development, even at a time when they may have had stunting in early childhood, are performing better later in productive life, they learn better, they have better jobs. So individuals may lose a quarter of average adult income. And calculating that at a societal level, the scientists that underpin the Lancet series, the economists, have shown that governments may lose, because of not reducing stunting to a level of less than 50%, the cost of that can be 2 to 3 times greater than the current proportional government expenditure on health. This is a huge cost of inaction. So where does this science lead us in terms of moving towards scale? First of all, within that recent synthesis of evidence that came through the Lancet, the concept of nurturing care was coined, and it was coined for the reasons that this early investment is so critical. Early really means early. And the cluster of interventions and support that comes around nutrition, health, responsive caregiving, safety and security, opportunities to learn must be seen as an integral part and must drive the agendas that we are moving forward in order to enable children to get on that developmental path that enables them to realize their full potential. What does it mean if that does not happen? Here you see a brief scan of children in orphanages in Romania. On your left side, you see the brain, a healthy brain. On the other side, the brain of a child who did not receive nurturing care in the orphanage. And you see the black spots and blue spots, which demonstrate that there is no function in the temporal lobes of the brain, areas where sensitivity, emotions are measured. This child is truly deprived. So parenting is important. The environment at the home is the foundation on which nurturing care rests. And while parenting is, in a way, an innate behavior, many parents and other caregivers need support to care for their child. It can easily break down under chronic stress, illness, substance abuse. We start seeing that where young people are living with busy, career-oriented lifestyles, they may not pay attention to their children in a way that is required to provide them with that nurturing care. So overall, that enabling environment is required for the individual child to receive nurturing care, the caregivers have the capability to provide it, supportive services are needed, enabling environment and enabling policies. And so if we look at some examples of these policies, we see that they relate to issues of time and resources. Maternity, paternity leave, breastfeeding breaks at work, leave when children are sick, minimum wage, health insurance, cash transfers for those who are disadvantaged, free primary education. These are some examples. We also have seen in a recent publication in Pediatrics by Vavida speaks to this, that many of the health and nutrition interventions that we know and we are working on for years now are having a direct impact on child development. And so these interventions, good antenatal care, quality newborn care, quality care for premature babies, and then taking it through childhood prevention and management of childhood illness are essential in order to support the development. So these interventions need to be implemented with quality and high coverage. But then there are these domains of responsive caregiving and early learning. And those traditionally in the maternal, newborn and child health platforms as we see them in many countries do not get the attention that they need. Fortunately, we have a better understanding of what it takes to support that, and I illustrate that by showing you Care for Child Development, which is a package of materials that was brought together by WHO and UNICEF. It provides the skills by counseling families on responsive interaction, stimulation, prevention, and solving of problems, and it does that through activities of play and communication. You see here the chart that serves as an aid to that process with age-specific recommendations. You see some illustrations of what it means to promote supportive interactions. We do have evaluations that show that this intervention is effective and interacts on practices related to nutrition, health, child development at the level of the child. They also have a positive effect on the family and the home, reducing stress, depression, improving responsive care, and changing the home environment with improved, more play items. So looking forward, we are aiming to bring this knowledge together in that nurturing care framework, what I spoke about on the first day, with the aim to increase that political commitment to create a global movement of investment around it. The proposed implementation model that underpins this framework will look at services that are universal, those that are targeted at families and communities at risk, and that are intensive for those individuals and families with special needs, as we have been hearing about this morning. Sample tools are available, and I thank Andy for speaking about the parents or the caregiver skills training. We have for the common platform, the Care for Child Development, we have the Guide for Monitoring Child Development. This conference has provided us ample opportunity to learn about these instruments. In terms of the organization of the actions, the framework will put nurturing care in the heart. It will focus on the first 1,000 days, as I mentioned, for the reasons to say early means early, and it will describe what, for this implementation model that I showed in the previous slide, is required in terms of building the information, empowering the community, strengthening the services, building the policies, and put that in an overall framework of governance, capacity development, financing, measurements, the things that typically come with government programs, but recognizing that this needs to be delivered in partnership where civil society, professional associations, private sector have a very important role to play. The framework will be underpinned by WHO guidelines that can have an impact on policy at country level, a monitoring framework, country profiles to show where countries are, and we will progressively build implementation guidance, drawing upon the many good examples that are available already in countries pertaining to this agenda. I must acknowledge the colleagues who put the Lancet series together for providing this focus and setting the seeds of this roadmap that I have just painted. And with that, I'd like to invite you all here to be part of this way forward. We will have a consultative process. We will use IDPA to reach out to you when the first drafts come out to seek your input. The first target date for that is planned in the middle of January, the 22nd. And so the overall message that I like to close with is the little quote in the bottom of this slide, that if we change the beginning of the story, we can change the whole story. Thank you.